Hi, I'm Dr. Mila Brujic, and welcome to this episode of the American Academy of Optometry Foundation podcast series, where we're going to be talking to Dr. Kaleb Abbott regarding ocular nutrition and its role with respect to renormalizing the ocular surface. So, Dr. Abbott, for the audience, tell them a little bit about yourself and your background.
Yeah, my name is Kaleb Abbott. I'm an optometrist and assistant professor at the University of Colorado School of Medicine. I practice in our dry eye clinic and our Center for Ocular Inflammation. So I see a whole lot of advanced ocular surface disease and just kind of very symptomatic dry eye patients in general.
This actually makes you a great candidate for discussing this. And really, the paper that we're going to be talking about today is a novel multi-ingredient supplement, significantly improves ocular symptoms, severity, and tear production in patients with dry eye disease. This is actually a results from a randomized placebo-controlled clinical trial looking at a nutritional formulation. So, Kaleb, can you do a deeper dive into this? So, what in this study set apart the nutrients that were in this formulation? What was actually contained in the supplement?
Yeah, I think classically we always associate a dry eye supplement with being an omega-3 based supplement, but this is actually the first non-omega-3 supplement actually indicated for dry eye. So it's not just targeting meibomian gland dysfunction in general, but actually targeting all different types of dry eye. And it's really trying to tackle the underlying problem of inflammation, which we know is a common denominator in essentially all different types of dry eye. And the ingredients included in this supplement is lutein and zeaxanthin, curcumin, and then vitamin D3. So lutein and zeaxanthin have anti-inflammatory and antioxidative effects. Curcumin, we know that can reduce pro-inflammatory cytokines in the cornea. And then vitamin D3 has been shown to improve dry eye symptoms in patients that are both deficient and non-deficient in vitamin D3.
So this is where the whole study gets really, really interesting because again, for my whole career, we've heard that omega-3s are really the way or the path moving forward with dry eye patients. And now we're actually seeing that the carotenoids, lutein and zeaxanthin, which we typically think about as macular pigments and things for prevention of macular degeneration, also indicated for patients with intermediate macular degeneration, we're now seeing that they have benefits on the ocular surface. That is a big wow to me. And with that said, can you describe a little bit how this study was carried out and what metrics were looked at?
Yeah, I think you're totally right. When it comes to lutein and zeaxanthin, we classically do think of that as something to help the retina, but now we're having to start to think about it a little bit differently in terms of its anti-inflammatory components and how that can actually help dry eye. So in this study, there was participants were randomized to either receive the actual formulation, so the actual supplement itself, or a placebo control, and they were instructed to take one pill in the morning each day for a total of 8 weeks. And the primary outcome measures that were looked at in this study were changes in tear volume, so as measured through Schirmer's testing, and then ocular symptoms that patients were experiencing as measured through the OSDI survey. And then they included a whole lot of secondary outcomes as well, such as tear breakup time, tear film osmolarity, MMP9 level, so a marker of inflammation in the tear film, corneal staining, conjunctival staining, artificial tear use, and then also artificial tear installation frequency.
So it sounds like they really did try and run this like a true clinical trial that you'd run for a pharmaceutical. Give us a little bit of a high level profile on what the results were with the study group versus the placebo arm.
Yeah, well, honestly, the results seemed a little too good to be true. Every single possible dry eye metric improved in this study. We saw that corneal staining and conjunctival staining improved by day 56. Tear osmolarity improved by day 56. MMP9 levels, which again, indicative of tear film inflammation, improved by day 56. Aqueous production, so lacrimal gland secretions, improved by day 28. Tear breakup time improved by day 28. And then patient symptoms, as measured through the OSDI survey, but also the speed survey, improved at day 14. And what improved in the OSD survey was not only symptoms of discomfort, but also the visual symptoms related to dry eye as well.
So Caleb, this is wild because it really shows the power of nutrition. We sometimes forget that we're a byproduct of what we ingest and what we digest and what we actually take in. Was there anything in the study that really kind of surprised you, or something that you felt like this is really noteworthy when you're talking about the influence of ocular nutrition?
Yeah, I guess there's a few things. So in the study, there's two things that did not improve, and that was the percentage of patients using artificial tears, and then also of those patients using artificial tears, how often they were instilling artificial tears. Now, I think some of that goes to probably just patient habits. They're used to using artificial tears. They're used to using it at this time of day and another time of day. So potentially that's why that didn't improve. But the results that were the most surprising to me was the huge reduction in MMP9 levels, which, as clinicians that do that testing diagnostically in our offices, we know that's extraordinarily hard to come by. Sometimes you'll see patients that are using steroids that still the MMP9 levels haven't decreased by the time we see them for a follow-up. And then the second most surprising thing was the huge improvement in tear film osmolarity as well, which is another metric that is sometimes difficult to improve in patients.
I think it just goes to show, and we've all seen this with patients who kind of make major lifestyle changes and come into the office, and we may be treating them for dry eye issues, and they come in one day and they look fantastic. And you ask them, has anything changed in their lifestyle? And they say, well, actually, yeah, I lost 30 pounds. I've changed my diet to this. I'm eating more of these things. And what it almost always boils down to is more of those foods rich in lutein and zeaxanthin just naturally, and eating better, less quantities of stuff. Looking at this is kind of a monumental study here. Do you have any final thoughts for the listeners?
I guess my final thoughts are that if this supplement truly works as well as this study indicates, that this could actually be a complete game changer in the field of dry eye. The first non-omega-3 based supplement that our patients can get over the counter for dry eye. And this could be huge in our treatment for patients and also improving the symptoms of our patients.
That's great. Well, Caleb, listen, thank you for joining us for this episode of the podcast.
Thank you.
And thank you all for joining us on this episode of the American Academy of Optometry Foundation podcast series.